We're at the Marion County Medical Center, where their motto is, whatever you do, do it well. Carolina People's coming up next. Good morning. Welcome to Carolina People. This morning we're at the Marion County Medical Center. We're focused on National Hospital Week in the Marion Regional Healthcare System. And we're visiting with Cynthia Johnson, the radiology manager here at the Medical Center. Good morning, Cynthia.
Good morning.
Thanks so much for being with us this morning.
Good to be here.
Incredible opportunity to highlight National Hospital Week and to highlight so many things that are going on in Marion County and here at the Medical Center. It is spectacular. Bruce and Pete on Monday kicking it off, and yesterday, and to think today to be able to focus on radiology. This is really important.
Yeah, we're very excited about some of the changes we're doing.
You've got to be, absolutely. Real quick about yourself, Cynthia. Are you originally from the area?
I'm from Gallivan's Ferry originally, and grew up there and stayed in the area. Went to school at McLeod's and moved back here.
You attended school at McLeod. Did you begin your career at McLeod?
I did.
Great.
I was in specials at McLeod's and worked there until I got married, and then I took a job in Mullins. They had an opening there.
When did you become the director of radiology at the medical center here?
When we merged here, but I was director of radiology at Mullins Hospital before that, and I've been with the system for 28 years now.
28 years?
Yes.
Lord.
I graduated and came and just enjoyed it and have stayed on.
Was the equipment from each of the two former facilities in Marion Mullins, were those transferred to the new facility when you all moved in here?
We did some. We replaced some of the units with newer technology or state-of-the-art. The mammographies, we moved each system from the previous hospital, and we had utilized it up until last year.
Is that right? If a viewer hadn't been in a hospital a long time, they may not think of exactly what is radiology. Well, just for somebody who hadn't been in a hospital, what is radiology?
Well, it covers a lot of fields. We have, it's not just basically X-ray. We do radiology, general radiography. We do special procedures, MRI, nuclear medicine, ultrasound, bone density. So there's just a variety of areas that we do cover.
And this is all done by machines?
There is machines involved, and radiation in most, with the exception of the ultrasound, and the MRI unit that we have.
Can you explain the importance of the investment by the Marion Regional Healthcare System recently made in bringing the first digital mammography system to the eastern coast of South Carolina? This is a huge deal, Cynthia.
Yeah, we were really excited. We were going to replace 2 analog units, and at that time, we'd budgeted for that. I had hoped for a digital in years to come, but it just worked out that we could do it at the same time. When we did the evaluation, the digital unit, the throughput was twice as much as just the volume that we would do with the analog. So we opted to do 1 digital unit, and that's how we got the state-of-the-art. There was some reimbursements that Medicare came out with that helped, fund it. Plus, it gave us the opportunity to offer the state-of-the-art technology to the patients here in the PD and be one of the first. So we were very excited.
You said the throughput was twice what the normal analog unit would have been. So you had 2 units and replacing it with 1 where the throughput was twice. And throughput, just simply for viewers' sake, what does that mean? Well,
before, when you would do a patient, you would have to leave the patient. You'd have to hand develop the film, or it was in a processor, but you had to manually put it in a processor. You would have to wait 3 minutes for that to process. You'd take 4 film. So none of that. Now with the digital, it's just like your digital cameras. You take a picture, you can review it instantly, and if you need to repeat an image or if there's motion on an image, so you either save it or you go ahead and reposition the patient. When you finish with the patient, you're through. She can leave. You don't have to check film. You don't have to develop film. if a processor jams, you don't have to go back and repeat a film. So the patients are out in about 8 to 10 minutes versus 20 minutes a normal mammogram.
That is amazing.
It is.
That is truly amazing. What was your first impression when you saw the capabilities of this machine?
It was really amazing because we really didn't think we would be able to get one this soon. It just, the timing was perfect. The image quality, it was unbelievable. Once we did a site visit at Greenville, we knew we were going to fight to get this unit because it was just outstanding. The images were just unbelievable, when you actually saw them on the monitors, and the radiologist could review them instantly. If you had a question, you could send it to the office. It was reviewed. Just so many advantages, with the digital, just like with the digital cameras today.
I think I saw on y'all's website, Cynthia, it's the Cintigraph 2000D, that this technology dramatically improves the ability to be able to gauge certain cancers, whether on women or on men, but really to be able to detect at a much quicker space. What's the significance of it?
Well, it definitely, the definition and the image quality is so much better. We did a comparison last year. I think we were almost recommending 50% more biopsies than we did the previous year, and also there was a high percentage of positive. I would have thought it would have been a little less. You're seeing more things. They probably aren't all positive, but the biopsies were a 13% increase on the positive finds.
Wow.
So we were real impressed with what the image quality and what it's already proven to be an advantage.
That's fantastic. Cynthia, when did you first put the new system into service?
It was in December. We really went live to the public. We did some employees and different patients prior to that. But January the 1st, we opened it to the public, and we have had no problems really with it since then.
And the digital mammography provides tissue scans, as you said, obviously at a much faster pace. But the older analog equipment was still providing those tissue scans, just not at the pace.
Well, with the analog images, you could not manipulate the image. You couldn't window level. You couldn't magnify. There was just so many features that with a digital image, you can blow it up. You can invert the image. You can view it in so many different ways. An analog is just a sheet of film. You can't do anything but bring the patient back, re-expose the patient, to more radiation if you had to do additional views or a different technique, because with a lot of dense breasts, you have problems penetrating it, and if you do, then you miss the skin line, and so it's a combination of two. With the digital, you have no problem with that. You can window level. You see all the way out to the skin line and the nipple very well with the digital mammography. So we were real impressed with the image quality and what we could do with them. They can annotate on the image, print a copy, send it to the surgeon, so when they do a biopsy, they know exactly what they're looking at, and have a film in hand. You can print as well, but it's all stored on a disc, so we really don't print unless we need to for referring physicians.
Cynthia, this is gigantic. This is a really big deal. Folks, would need to travel in from all over to have the opportunity to be able to have that utilized on them. That's amazing.
We have a lot of patients that come from Sumter, Columbia. So we've been really excited.
You've got to be. And you talked about visiting it, checking it out in Greenville, seeing it in use, knowing that y'all were going to work hard to get this in. Can you lead the viewers through the events leading up to the decision to go ahead and commit to the Cintigraph 2000D?
Well, we basically went and we talked with the staff at the hospital there and asked what they felt like the advantages were. It was just really no question once you saw the images, and it was just so much easier on the patient because they knew immediately if everything was going well, if they had to come back to have any additional views. It was just a pleasant experience. It took the dark room completely out of the picture, which would take a lot of time really from a staff They had to do a lot of QC. They would almost have to wipe it down with a cloth, the walls, the ceilings, just so they didn't have artifacts in the film. So the digitals really helped us.
So the staff has been very receptive, Cynthia.
I don't think they would go back to an analog.
Ooh, wow.
So it's, it's probably a good recruitment and retention.
And you've received good response from outside of your normal service area here. Really?
We have. We have patients that come from Conway and other areas. And, our biggest input to the patient is, you need to encourage your local hospital to put in a digital mammography because it's just the state of the art, and it's after seeing this, we would like for other hospitals to also follow suit.
Good for you. I mean, that's important to recognize. Your goal is the health of the patient. Right?
Yeah.
And if they need something immediately, they may need to go to a hospital that's closer to them. I mean, that's a really good commitment. I'm glad, and I think that's reflecting what Pete said earlier on, whatever you do, do it well.
Exactly.
And that's obviously reflecting exactly what you said. The accuracy of the new system has become evident.
Yes.
Absolutely.
We feel like it, and the radiologists, they don't have to hang the film, they don't have to mask the film. They come in, they're on monitors, they just sit down, they program the monitors in the manner that they want to view the film. Each radiologist has their own specifications for the way the film are hung. The computer does it, it brings them up in the order they want it, they read it, and that's it. They don't have to pull it out of a jacket. It's all on a monitor and it's viewable, and if they need to print, they can print.
We've got about a minute, Cynthia. The practical use of this aside from, what would be some of the other uses aside from being able to gauge these aggressive forms of cancer in women?
Really with the digital mammography, it's not, but in the future they have a lot of new technology that's coming out that has not been FDA approved yet, that it offers us the opportunity to add this software to this current technology and grow from there. So
You can add software later. Fantastic. Cynthia, what do you like best about what you're doing?
I like bringing the state-of-the-art equipment here so that we can provide the best patient care, and making sure that we stay competitive with any other imaging center that, we can offer those services here. We may not always be the first, but we want to be at least comparable to the other hospitals. We don't want to have any suboptimal equipment that really doesn't provide the best for the patient.
Providing the best for the patient. You heard Cynthia Johnson say it. We've heard it all week. Whatever you do, do it well. State-of-the-art equipment, providing that won't always be first, but at this point, Marion Regional Healthcare System clearly is that. Cynthia, thanks so much for being with us this morning.
You're welcome.
Stay tuned to more Carolina People coming up next. Good morning. Welcome back to Carolina People. This morning we're at the Marion County Medical Center. We're focused on National Hospital Week in the Marion Regional Healthcare System. And we're visiting with Deltah Lowrimore, the Director of Emergency Room Services at the center. Good morning.
Good morning.
Deltah, thank you so much for being with us this morning.
Good to be here.
Incredible thinking. Cynthia was in and talking about radiology and so much that goes into the hospital and so many activities going on there. But the emergency room is really what everyone around the country, when they think about a hospital, they think about the activities. I guess the popularity of a show like ER has probably helped sponsor a lot of that. Is this true to life, Deltah?
There are a lot of aspects of it that are true. You'll see the same equipment, the same type of things going on with patients, the same type of patients coming in.
So there are aspects of it that... are there other TV shows that tie in that give a more accurate view, or would ER is really the one?
I think that one's very accurate. I've watched it a lot just to see the comparisons, and it's like being at work.
That's amazing. What's it like being the Director of the Emergency Room Services, Deltah?
It's interesting. It's a challenge, a daily challenge, but it's something that you enjoy. It keeps me coming back every day.
I'm sure, waking up knowing that. A real challenge is going to be taken on no matter what the day is.
That's right.
Delta, real quick about yourself. Are you originally from the area?
Yes, I was born and raised here in Mullins. Family's still here. I have a husband, 3 children, and mother's still here.
Is that right? All here in the area.
All
That's
here.
fantastic. And when did you become the director of the ER?
About 19 years ago now.
19 years you've held the position as the director of the emergency room?
Yeah.
That's spectacular.
I enjoy it. I really love my work. I enjoy the people in the community and the people at work.
Can you share with the viewers a little bit about the responsibilities associated with being the director of the emergency room? Do you still have activities as a nurse?
Yes. I am actually the nurse director. We do have a physician director, so I can't take his credit there. But I do nursing duties along with the staff on a daily basis because I love to keep my hands in it. So I'm not one to just sit behind a desk and do things. And the challenge to me and the enjoyment is the patients and caring for them and doing what I can to make a difference.
Yes. Delta, can you share with us a little bit about what it's like being a nurse in the ER?
Every day is a little different. You never know what you're going to do, who you're going to see, and what's going to happen. So it's kind of an adrenaline rush at times. So there's that challenge there and the unknown. It's not the same thing over and over. So I think it keeps us focused. We have things to do that are totally different from any other area of the hospital.
There's the adrenaline rush still comes for a lot of folks associated with other parts of the hospital, but probably not in the same way. How do you think you all are different?
The speed, a lot of times, of things coming in. EMS is bringing a patient in, and you get a report from them. You have an idea of what they've got, what's going on, but it's still that factor of unknown, and anything can change, and you have to react quickly.
Yes, and to think, 19 years as the director of emergency room services, what do you think originally prompted you to go into the ER?
A former director of nursing that I was very close with and knew, and just asked me if I'd try it. I loved it. I have experimented with other areas of the hospital through the years. Over the first 5 years, I did some work on the med-surg floor, telemetry floor, ICU. Even did some outpatient surgery, but I always came back to ER, and that's where I've stayed.
Wow. Delta, is there do you perceive a special kinship within the staff of ER?
Yes, I think because of the stress level that we see in the ER, everyone there works closely together. It's like a small family, very close-knit.
When we think about treatment and the treatment that the emergency room staff would provide, is the treatment, how do you, I mean, obviously it changes day to day, but what is the treatment like?
Treatments vary on the patients that we have, and we can treat patients from birth to death, which is unfortunate, but it's something that does happen, and we see medical problems, surgical problems, obstetrical, psychiatric, so treatment varies from person to person.
I think one of the accomplishments that Pete Mulford earlier in the week on Monday was cited was the state's designation of Marion Regional as a Level 3 trauma center.
Right.
What's the significance of that designation? How does that impact viewers within our community?
Well, we recently became the 24th designated trauma center in the state. For us, it means education that has been expounded on here for the nursing staff and to some extent the physician staff. So we're better educated to deal with trauma now. It does impact the whole hospital because we now have a better response system from the scene of an accident with EMS to us involving radiology, lab, or anyone else is needed, and better physician response in a more timely manner. So it impacts us and the patients.
That's wonderful. The state has also utilized your facility for mental health patients. Do they come through the ER on a pretty regular basis?
We have times when we do see a lot of mental health patients. We do evaluate, treat to the best of our abilities, and then fortunately we have been trained to assist these patients to some extent in crisis prevention. We have a program going on here now with that. So we have a sitter program that has been trained, and orderlies and ER staff are being trained in that. We do hold patients at times awaiting a state bed.
So the ER staff does have special training in dealing with mental health patients.
We're in the process now of getting all that.
How about efforts underway for emergency preparedness? Are there currently efforts underway constantly for emergency preparedness?
Constantly, yes, to some extent, but in the last several months the awareness has risen, and we're accepting the challenge. We have implemented a hospital emergency incident command system and are now going through training for hazardous material identification and decontamination.
Oh, wow.
We're in the second phase of that.
How about, are there other areas of the hospital that are involved with that as well?
Yes, we've tried to include an assortment from the hospital so that just nursing is not tied up with decontamination and they're freed up to take care of patients. So we have nursing, we have orderlies, we have plant maintenance, respiratory, and radiology that are all being trained in the decontamination. We have purchased the portable shower system. So we're setting that up as part of our training and actually putting patients through.
Deltah, what's it been like growing up in Marion County, seeing all the changes that have happened in the county over the years, being at the helm of the emergency room for almost two decades now, to see all the changes in the county? What's that been like for you?
Very interesting, very challenging. I love it.
And your family?
They've accepted the long hours.
Yeah.
And coming home at times with less than a nice attitude, but they have accepted and they're very supportive.
They know your goal is obviously helping folks at the most traumatic times in their life.
That is my goal. If I can help one person a day and learn one new thing a day, then I'm satisfied.
Absolutely. You're probably able to take some of that back to the family, I mean to the household, or extend that out in your greater family.
Yes. It's been quite a challenge with them, and I try to instill that in my children.
That's wonderful. Do you think any of them have aspirations to get into the healthcare industry?
Right now, one daughter does.
Really?
Yes. My husband is a paramedic in the county, so it's kind of around them on a daily basis.
Yeah,
so
it's
they're
in the
used
blood.
to it. Yes.
It's in the Lowrimore blood. How exciting. How do you and your staff support each other through the tragic cases that come through the emergency room, Deltah?
Being so close as a family unit, we're very supportive of each other, and we also at times have debriefing sessions after some major traumatic event. And periodically I will talk with a staff member on a one-on-one basis if we need to do that.
Deltah, what do you perceive as the greatest challenge the emergency room has in serving the community? I mean, there's so many challenges. As you think about that on a daily basis, you're constantly faced with challenges. How about in serving the community writ large?
I guess the greatest challenge would be to do the best that we can on a daily basis and keeping up with all the changes that occur daily. And of course we want to do that in a timely manner for everyone.
As you look back over all these years in nursing, can you think through some of, maybe a couple of the most significant accomplishments for you, both in your position as well as through the Marion Regional Healthcare System?
I guess one of my major accomplishments is just seeing a smile on a face after you've done something, or having someone say you made a difference. Going through classes and training and getting extra certifications or being able to teach something, that's good, but it's that patient contact and a thank you or a smile.
In the same vein, I guess, I suppose at some level that is exactly what you like best about what you do.
Yes, it is. Just making a difference. If it's just one person a day.
Deltah, a couple days ago in preparing to talk to you today, I was looking at the website at the Marion County Medical Center website and saw on there it had a little line in the ER side. I wrote it down. The code goes out over the speaker system from all parts of the hospital. The emergency team breaks into a run. at some level, you all are all still spread out and interacting with other folks throughout the hospital when there's a downtime, and you've got to be ready at all times to jump into action. What's that like?
That's the adrenaline rush that gets you going, and it's a challenge. But it's when you have all the backup from other areas of the hospital that come in. You have labs showing up within 2 minutes with blood ready, and you have the x-ray machines brought over, the portable units, and they're ready for action, and you know your surgeon's on the way, and he's there if you need him, or the orthopedist. You have your orderlies as backup for lifting or whatever you need them to do, and extra nursing staff that can take care of other patients in the ER while our staff deal with trauma patients. It's the camaraderie, the teamwork.
You heard her say it, the camaraderie, the teamwork. Delta's used some amazing words as we think through searching for a smile on the face. Almost 2 decades as the Director of Emergency Room Services, Marion Regional Healthcare System. In this regard, thinking through a life of truly making a difference, from life to death. Delta, thanks so much for being with us this morning.
Thank you. Enjoyed it.
Absolutely. Stay tuned to more Carolina People coming up next. We want to thank Cynthia Johnson and Deltah Lowrimore, as well as the Marion County Medical Center, for making today's Carolina People so special.